So we're talking about the cervical screening. Okay, so the cervical smear, as we used to call it in the UK, or pap smear, as you might know it in other parts of the world, like in the US. If it's your first time, feel nervous, you're not alone. And you're actually watching this video at the very right time, because I just had mine last week. I'm a women's health doctor, still have my cervical screen. And I think it's really important that when you're invited for yours, please attend. Don't ignore it, please. You might feel, especially if it's the first time, you might feel, oh, you're worried about what's going to happen. Please don't be scared. Let's talk about it. That's the reason for this video. So let's explain the process, why you need to have it done, and what you can expect, so that when you walk into the room, you're feeling more confident. We used to call it a cervical smear, like I said, but it might be known as a pap smear. It's a screening test. Screening. It's not a diagnostic test. A screening test means that we're looking for early signs of a change that might mean a disease condition in years to come. So that's why it's not a diagnostic test. Okay. A diagnostic test is that, oh, the problem is there now. And we're doing this test to confirm that this is the problem. So there are two different things. The cervical screening is a screening test, okay? And the main reason that we're doing it is because we're looking for any abnormal changes in the cells of the cervix, that is the neck of the womb, long before they have a chance to turn into cancer. And it's actually one of the most successful cancer prevention programs in medical history. It is well worth your time, okay? Now, these days, many of these tests, if not all of them, but I know different countries have different rates. These days, many tests are using primary HPV tests. Yes. So HPV is a human papilloma virus. This is the virus responsible, we think, for many, in fact, for the majority of cervical cancer cases. Now, I know when you hear HPV, you think, oh, isn't that the what? Yes. So we have the high risk and the low risk. Low risk HPV, that's genital warts. High risk HPV, cervical cancer. Okay. So nearly all cervical cancers are caused by the HPV high risk strain. So this test, the primary HPV test, they'll be looking for whether that virus is present or not. And that actually, we feel, is more effective at identifying a woman that is at risk. So when you go for your test, that's what they're doing. They're looking for the virus. They also have the potential to look for changes in your cell. But many countries are moving towards, let's test for the virus first, and then the testing for the cell change can be a secondary backup test that they can do just to look at your risk. Okay, so now we've got that out of the way. What happens when you go for your test? So it's a private room. It's an intimate examination. You have a nurse or doctor. In the UK, it's mostly our nurses who do the cervical smears. But of course, lots of doctors can also do it and are trained to carry out the cervical. I keep calling it cervical smear because that's when I trained. That's what it was, cervical screening. Okay, so you're in a private room and you can ask for a chaperone. Please ask for a chaperone if you feel uncomfortable. If you want to come in with a friend or family member to be with you while you're having your test, that's fine. Just checking with the person that's your clinician on the day. So they'll ask you to undress from the waist down. They'll screen you off. So you'll be, you have your privacy, and you'll be asked to take your undies off. And then you'll be given a little towel or sheet just to cover your bottom parts while your clinician, your nurse or doctor gets together the equipment. Basically, they're going to use an instrument called a speculum. They'll put it gently into the vagina to open up the vagina so they can see the cervix. And then they'll use a very soft brush. So once they popped in the speculum, it opens up the vagina wall, okay, so that we can see right at the cervix. And then we're going to use that very soft brush to just get those cells around the opening of the neck of the womb, okay? Some ladies are worried about having the speculum inserted. Totally appreciate that. And you can certainly ask your nurse can they use a smaller speculum? In fact, ask them to make sure that it's wet, especially if you're somebody who has dry tissues. I'll mention that in a moment. But there are things that you can ask for if you feel uncomfortable. You can ask them to stop at any point if you feel uncomfortable. So they're going to use this small brush to quickly take a sample of cells. This is literally less than 30 seconds to do. Okay, so the speculum they've got their little brush. Once they can see the cervix nicely, they've got the little brush, and then they're taking the cells literally under a minute, less than 30 seconds that they get. So you might feel maybe a bit of a scratchy, you may get a bit of a cramp as they do it. You might feel some discomfort as the speculum is popped in, and It's once they've taken the sample, the speculum is taken away. That's it. Yeah. I want to emphasize, especially for a first timer in the UK, when we start our screening for girls in their mid-20s, you're in charge. So you might feel worried about this and having an object inserted into the vagina. Please let your practitioner know. You can have a conversation before this starts and help them, ask them to, get reassured about what's going to happen. Ask them to explain what they're doing while they're conducting the procedure. I'm always happy to talk while I'm doing these things. I like to tell women what I'm doing, what I'm seeing as I'm putting the speculum in, so that they understand. And it also helps to distract from what's going on. And like I said, you can ask for a chaperone. You can bring a friend with you for your own appointment. Now, to prepare yourself to really get the best results and make sure that you don't get you don't have any faulty or error results with your test. We usually advise avoid having sex in the 48 hours before your test. Make sure you book your appointment away from your period so that doesn't, interfere with the test results. Avoid using any lubricants, vaginal creams or anything in the 48 hours beforehand. Now, to prepare yourself to really get the best results and make sure that you don't get you don't have any faulty or error results with your test. We usually advise avoid having sex in the 48 hours before your test. Make sure you book your appointment away from your period so that doesn't, interfere with the test results. Avoid using any lubricants, vaginal creams or anything in the 48 hours beforehand. So I want to say it's a really important test. You will literally not be in the doctor's office for up to 10 minutes unless you're having a pretty lengthy conversation or other things develop. The test itself is less than 2 minutes once it's done by somebody who's experienced and, knows what they're doing. Minimal pain, but if you feel uncomfortable, of course, you can take some painkillers like paracetamol before you go. Tell them that it's your first time. Please feel free to say it's your first time so they know what your experience is and how to make sure that they're keeping you on the same page and carrying you along while the procedure is going on, providing you the reassurance, explaining what they're doing. And of course, it might help to take deep breaths. Okay, so while the speculum is being put in, you're taking deep breaths, to calm yourself, to put your mind not just focused on pain, but just to help to settle you down. Okay. I want to emphasize that you have a right to dignity. So to be in a private room, to be nicely screened off, giving space to dress and to undress and to dress afterwards, to have all your questions answered. It's something that you should do. Really important. A test that can save lives. And I'm concerned about women or people who don't come for their tests, who ignore their tests, appointments, don't book their appointments when they get the letter, thinking, oh, why bother? It is important to bother.